Good day, viewers. My name is Gabriel Iberase. You're welcome to the Women's Health Channel. I'm an obstetrician gynecologist and an IVF expert. Today, I'll be talking to my viewers on the options for fertility treatment. Options for fertility treatment that is available in most centers in Nigeria. Infertility, I've defined before in my previous videos, is a challenge in Nigeria. And a lot of our women do not know where to go to. A lot of our women do not know what to do. They don't know how to assess proper, comprehensive fertility treatment. I've seen women who would tell me that, oh, if I'd met you early enough, I've been to several places, I've spent so much money, I've been to so many places, and I discovered you late. Like I tell a lot of people, the world is a global village. Apart from me, if you go online, there are a lot of centers in Nigeria that can help you, that can sort you out. I'll quickly outline the options for fertility treatment, options of fertility treatment that is available in Nigeria. In my subsequent video, I'm going to talk in detail about in vitro fertilization, IVF, intracytoplasmic sperm injection, and other forms of assisted conception. I would want us to know that for a woman to be able to achieve pregnancy, the woman should have an intact reproductive tract. That means the vagina, the cervix, the uterus, the fallopian tubes must be intact, and the ovaries must be ovulating, that is producing eggs cyclically, that is every month. The man should have functional spermatozoa, right? That means that the seminal fluid parameters must be okay, must be normal. It also means that it should not have any form of blockade, right, in its own reproductive tract. So this is important. This is essential that our women know this. There are different options. Maybe I'll start with what we don't commonly embrace in Nigeria. For a woman who's been trying to get pregnant for so many years, adoption is an option. But a lot of people still believe that there is stigma associated with adoption. You know, I've seen women who, in the process of pursuing adoption, spontaneously they get pregnant. And even after the adoption process, getting the adopted child into the family, they achieve pregnancy. So if you're not able to get pregnant, adoption is a way out of it, and you can go through. There are different governmental processes, right, that you can use to get an adopted child. The other thing I want to talk about, apart from adoption, is spontaneous ovulation. Women who have normal cycles, women who ovulate normally, sometimes they don't cohabit with their husbands at the appropriate time, that is during the ovulatory period. I've seen a couple some years ago, the man was in Abuja and the woman was in Benin, and they were trying to get pregnant, and they meet just once in 3 months. That would be very difficult achieving pregnancy. So I had to counsel them, even without any investigations or treatment. And the man relocated to where the woman was in Benin, and today they have about 4 or 5 children. So for those people who do not have any challenge, normal seminal parameters, they are ovulating normally, they can achieve spontaneous pregnancy, but because of separation or distance, we can teach them about their fertile periods and tell them about timed intercourse, and you don't need to give them anything. just tell them about their periods of ovulation, and tell them when to meet, and by God's grace, pregnancy would ensue. But there are some people who would have ovulatory challenges. You just need to induce them a little bit, give them some ovulation induction agents, and do follicular tracking for them by way of transvaginal scan. You know when they are going to ovulate, and you do what we call timed intercourse. You tell them those days to meet with their husbands, and pregnancy can also ensue from that. But before undertaking all this process, we must have investigated them, and we must have ruled out any form of tubal obstruction, right? Tubal obstruction, or any form of genital tract obstruction, or even uterine endometrial pathologies. We must have ruled all those out, making sure that both reproductive tracts are intact and they are functional. Another fertility option which we also employ is a form of assisted conception, and it's called intrauterine insemination, what we call the IUI. And we usually do that. There are actually two types of that. We have the intrauterine insemination using the husband's semen, and sometimes we have some men who don't have sperm cells. We call them azoospermic men. For such men, we do what we call intrauterine insemination of the donor to help such men, meaning that we get donor sperms and we treat them in our IVF assisted conception laboratory, and we use the best sperms, the donor sperms, and inject it into the woman's womb or uterus after having given her some fertility drugs inducing her ovulation also. And we do it at about the period of ovulation. That's when we do the IUI, intrauterine insemination. And for those men who have normal semen parameters, we also do the same thing, but it's just that their sperm cells will be used for their spouses. But those who are azoospermic, men who do not have sperm cells, right, we get donors, and they can donate for that. But that is done after proper counseling, and both couples would actually agree to do that. You don't do that without consent. They must agree after proper counseling. Then another form of fertility treatment that a lot of people don't know about still, despite the fact that the first baby was delivered in 1978, Louis Brown, and the first baby, IVF baby, also has a home baby now. She's delivered normally, not even through IVF process. There are lots of ethical, moral issues around it. Some people also have some spiritual issues about it. But the truth is that I normally tell people it's a process that actually also requires the mercies of God. Let me use that word. So it doesn't just come easily. Success rate is not 100%. Now, I'll talk about that in the next video. In vitro fertilization, let me describe it this way. It's a form of assisted conception in which the woman's egg and the man's sperm are brought together outside the body, right? Fertilization takes place and it's incubated, right? And the product is incubated in the incubator for about 2 to 5 days. Embryos are formed, which are now transferred back into the woman's womb for pregnancy to ensue. Success rate has increased all over the world now. Presently, lots of centers can boast of success rates of between 40 to 60%. Anybody tells you that it's 100% is telling lies, right? It's not true. I would want my viewers to understand that seeking fertility care or fertility treatment early enough is imperative for good outcome. The younger you are, the better your chances or your prognosis, and the older you are, the less the success rate. But I want you to understand that there's virtually no woman now that cannot achieve pregnancy, right? There's virtually no woman that cannot achieve pregnancy by way of IVF. Even those men who have very poor sperms that are non-motile, that don't move so much with reduced motility, we can do, apart from conventional IVF, we can do what we call intracytoplasmic sperm injection for them, in which we're using the ICSI microscope, the micromanipulator, we take the sperm cells and inject them directly, physically, right, manually into the cytoplasm of the eggs, and embryos would be formed, right? Fertilization takes place and embryos are formed and will transfer into the woman's uterus. These are the options of fertility treatment. I will do a video on fertility investigations also. I would want to encourage our women once again that it's your God-given mandate that you be able to achieve pregnancies. You are able to achieve pregnancies, getting your own baby, right, in this world. And this wisdom given to men is from God. It's not from the devil. And I want you to know that men are not trying to play God. Because if men are trying to play God, that is what some people think. Whenever our women come for IVF, they will have 100% success. So why do some people fail? So even when you are coming, you really need to still pray and trust in God, while your doctors do their very, very best. I want you to understand that success rates have increased, women are getting pregnant, and it is working. And it is your turn also to get pregnant. It will work for you. Thank you very much for listening.